Morning everyone, Shraddha Asnik here. In last lecture, we studied about the pharmacology. Pharmacology, it is the branch of science which concerned with the study of drug and their effects. Now, therapeutics. Therapeutics, it is the branch which refers treatment of disease. Therapeutics, it is the branch of pharmacology which deals with the cure of disease, healing the particular disease condition. It is known as the therapeutics. Then toxicology. Toxicology, it is the branch of pharmacology or science which deals with the study of effect of poison, method of detection, diagnosis and treatment of such poisonous condition is known as toxicology. Then pharmacy. Pharmacy, it is the branch of science which deals with the preparation of drug and drug combination in suitable dosage form which are convenient for the administration. Chemotherapy. Then chemotherapeutic agents. What do you mean by chemotherapeutic agent? Chemotherapeutic agents are also known as cytotoxic drugs or anti-cancerous drugs, which are used to treat cancer. They are worked by killing cancerous cells or preventing them from dividing. Chemotherapy, it is the branch of pharmacology which capable of destroying the causative agent without destroying the host cells, which means they are worked by killing cancer cells or preventing them from dividing. So, these are the some definitions which comes under the pharmacology. Now, we are going to study about the routes of administration of drug. So, now we are going to study about the routes of administration of drug. So, the way of administration of drug into the body is known as the route of administration of drug. There are many routes of drug administration by which the drugs can be administered into the body. The chosen routes depends on number of factors including the desired speed of onset, the stability of drug in digestive system and intended location of action. There are many routes of administration such as oral route of administration, parenteral route of drug administration, intravenous route of administration, intramuscular route of administration, subcutaneous route of administration, rectal route of administration, vaginal route of administration. Intravenous route of administration, which means the drug is directly administered into the vein, usually in the arms. It is the fastest way to get a drug into the bloodstream. It is used when need to work quickly, such as antibiotics or painkillers. This route is known as intravenous route. Then intramuscular route. In this route, the drug injected into the muscle. This route is slower than the intravenous route but still relatively fast. This is used for drugs that need to work quickly but cannot be given intravenously. Then subcutaneous route. In this, drug is given under the skin, it is slower than the intramuscular administration of drug. This route used for the drug that need to work quickly but cannot be given intravenously or intramuscularly, such as insulin. Topical route of administration. In topical route of administration, the drug is applied to skin or mucous membrane such as nose, eye, ear, and this used for a drug which is need to act locally, such as creams for rashes or eye drops for allergies. Inhalators. Inhalators, in these, drugs are inhaled into the lungs through the nose or mouth. This route is used in asthmatic condition. Then the most important route of administration of drugs are oral route of administration and parenteral route of administration of drug. In oral route of administration, it is the most common route of drug administration, like simple dosage form like tablet, capsules, suspension, emulsions are taken from the oral route of administration. This oral route of drug administration has several advantages and disadvantages. Advantages like the first advantage of this route is it is simple and most convenient for administration of the drug. In this case, self-medication is possible as the drug is in simple doses form like tablets, capsule, like suspension, emulsion. Then it is not expensive as the parenteral or other routes of drug administration. It is cheap. Then the most important advantage of oral route of administration is in case of toxicity, the withdrawal of drug is possible. These are the some advantages of drug oral route of administration. Firstly, it is simple and convenient for use. Then self-medication is possible. If in case there is toxicity of drug, the withdrawal of drug is possible. The disadvantages of oral route of administration is it is slowly it is onset of action is slow. This route is cannot be useful in unconscious and uncooperative patient. If the patient is unconscious, then the oral route of administration is not useful. Then the third disadvantage of oral administration of drug is 100% absorption of drug is not possible. Why? Because the drug is destroyed by the digestive enzyme. So, there is not 100% absorption of drug. This route is not useful in the emergency condition. These are some advantages and disadvantages of oral route of administration. Then, parenteral route of administration of drug. The route of administration other than the oral route is known as the parenteral route of administration of drug. This route also have some advantages and some disadvantages. This route is directly opposite from the oral route, which means the advantages of oral route is the disadvantages of parenteral route. Like the main advantage of parenteral route is 100% absorption of drug is possible as the drug is not destroyed by the digestive enzyme, and this was the main disadvantage of oral route, that ki 100% absorption of drug is not possible as the drug is destroyed by the digestive enzyme. So, advantages of parenteral routes are onset of action is very quick because the drug directly goes into the blood circulation. Then, irritant and unpalatable drug can be given by this route. Then, this route can be useful in unconscious and uncooperative patients. And the main advantage of this route is 100% absorption of drug is possible as the drug is not destroyed by the digestive enzyme. And by this route, low doses are effective, and in emergency condition, the parenteral route of drug administration is very useful. This route has some disadvantages. The main disadvantages of this route is once drug is administered, withdrawal of drug is not possible in case of toxicity, and this was the main advantage of the oral administration of drug. If the drug is orally administered, if in case of toxicity there is the withdrawal of drug is possible as the drug is administered by oral route. So disadvantage of parenteral route is it is inconvenient, then self-medication is not possible, and once the drug is administered, the withdrawal of drug is not possible as in case of toxicity. So this is the route of administration of drug. In next lecture we will see about the absorption of drug and factors affecting on it.